The overall goal of this procedure is to diagnose breast cancer-related lymphedema and evaluate the therapeutic effect of resistive exercise by using ultrasonography to measure the thickness of subcutaneous tissue.
This method can help answer key questions in the diagnostic field of lymphedema, such as parametry and bioimpedance spectroscopy. The main advantage of this technique is that it's an easily accessible and safe and inexpensive method to perform.
Begin by laying the patient's arm in a supine position with both arms on the bed. Use a pen to mark the midpoint of the wrist crease, the midpoint of the medial and lateral epicondyles at the level of the elbow, and the bicipital groove. Then connect these points using a ruler. Next, mark the first target area 10 cm proximal to the elbow point along the line between the elbow and bicipital groove, and the second target area 10 cm distal to the elbow point along the line between the elbow and the wrist. Then, switch on the ultrasound system. Enter the 2D mode of soft tissue via the keyboard. Set the depth to 5 cm and choose the 14L5 linear array transducer. Apply sufficient gel to the ultrasound transducer and place it perpendicularly to the upper limb ventral axis. The short axis view to capture the image where the thickness of the gel is at least 1 cm and the soft tissue contour is not distorted. Next, select the calibrator in the software via the keyboard of the ultrasound system to draw a line between the muscle and the subcutaneous tissue.